Hi there, welcome to today's event. I'm Michael Giannotti, and today we're going to be covering emergency response data tracking to maximize critical resources during COVID-19 and beyond. Again, my name is Mike Giannotti. I'll be your host today and doing the production, but today we're going to be joined by Chauncey Larson and Holly Kelly. Did I say that right, Chauncey?
Yep.
Okay, I apologize. Um, our moderator for today's session will be Samantha Brown, or Sam, and she will be taking your questions, queuing them up. But before we get started, we have some housekeeping, and then we'll go on to our presentation. So let's go ahead to our next slide. So as always, this event is brought to you by the Microsoft Healthcare and Life Sciences Group. You can always visit us at our blog at aka.ms/HLS blog. That's aka.ms/HLS blog, and you'll find myself, my colleagues. You can request content. You can interact with the people that are posting there. So please check it out. We have a wealth of content, not only around what's going on now, but in healthcare and life sciences in general. And much of this can be further used in other scenarios, even beyond healthcare and life sciences. So moving on to our housekeeping items. A couple of things before we get started. First of all, we encourage everybody who attends today's session, ask questions. We're here to answer your questions, to get them answered, not only to share the material, so please ask. Also, all questions are moderated, so you'll notice as you post a question, it will not appear for all attendees unless the moderator, in this case, Sam, so you can blame her. No, but in this case, Sam, she'll be.
Thanks, Mike.
You're welcome. So when she publishes those, they'll appear. But she can also dialogue back and forth with you, get clarification, etc. Around those. Finally, another last thing, we love to know who you are and where you're joining from. So please send us a shout out in the Q&A panel. Let us know your first name, if you can, where you're joining from, so that we can, give a little shout out to you. We love to hear from you. It could be your state, your city, your country. We tend to get people from all over. And then finally, at the conclusion of today's broadcast, the recording of it will be posted to our blog at, you guessed it, aka.ms/HLS blog. So you'll be able to find the recording and all the resources mentioned today. Now, finally, going on to our Q&A panel. If you do not see it, simply go up into the upper right-hand corner. You'll see a dialog box with a question mark. If you click that, it'll open it. It will also close it if it's already open. Once you've done that, and you should see this panel here, you can put your name for any question, or you can post anonymous. Ask your question and click it, and again, it will show up for our moderators. And then at that point, we can respond directly to you. And look at that, we have Edward from Dubai is our first shout out. So there we go. Dubai is in the house. But we love to hear from you. Post your questions and your shout outs. And then finally, on to today's presentation. So I believe, Chauncey, you're going to take it over, aren't you?
Sure am.
So we're going to push Chauncey live, and there you go. As soon as you share your desktop, you are at large and in charge.
That's scary. All right. So as Michael said, my name's Chauncey Larson. I am the Power Platform Technical Specialist covering healthcare in the West. So I'm based out of Denver, but if you draw a line down the middle of Denver and everything west of that line from a kind of a strategic account healthcare perspective, I focus mostly on Power Apps, Power Automate, Power Virtual Agents, and Power BI. So that all makes up our Power Platform. So that's why I'm a Power Platform Technical Specialist. And then I'm joined today by Holly Kelly. Holly, you want to introduce yourself?
Sure, thanks, Chauncey. So yeah, my name's Holly Kelly. I am another Power Platform Technology Specialist in the West. So Chauncey and I share accounts. I focus primarily on the Power BI side. I've been doing BI for about 22 years now. So, super deep on the data side. And so Chauncey and I work together along with our Power Apps engineering team to create this awesome solution for one of our customers, and we're excited to share it with you today.
Yeah. So before we kind of get into the demo and kind of talking about the actual solution, what we really wanted to do is maybe set up a little bit of the idea of what Microsoft is trying to achieve with all of these different solutions. So, we've heard a loud and very clear cry for help, for support in any way possible. And I think all industries are hearing that right now, right? And of course, Microsoft as a technology company, what we want to do is be able to quickly and with agility address these needs on all levels. And so this idea of flattening the curve to where we can really kind of address what is needed by our healthcare systems is something that we're really kind of targeting. We're not there to replace systems of record. We're not there to become the next healthcare entity. We don't want to do that. What we really want to do is support our business frontline workers to be able to take care of their needs at the time that they need them. So in this case, what we're going to really be focusing on is this kind of track capacity and supply chain. There we go. So really, we're focusing at this hospital facility level and bringing in kind of this emergency response hub. It's a suite of applications, and I'm going to show you the blog here in a little bit just so you can kind of get access to it whenever you want. But again, the idea here is we are trying to exist in a time where access to our normal systems of record, or maybe even quick access to being able to jot down and track and maybe cross-reference against our systems of record isn't really available. The individual that we worked with out of our customer that encouraged us and really needed this solution, his claim to the big thing that he kept saying was he wanted to work in a wartime or out of tents, or kind of in a time where access to systems of record is it's difficult. And so we had to keep that in mind as we built this stuff out. The other thing that is coming soon, which is why it's mentioned here, is that we are planning and thinking broadly about these templates to make sure that they can be addressed at a network level, statewide, region-wide, system-wide, whatever we can do to aggregate the data at a high enough level to start making an impact and to start driving decisions that really kind of address these critical needs. And by the way, Holly, I talk a lot, so feel free to chime in if you have anything to add on any of these things.
Yeah, thanks, Chauncey. Yeah, I mean, the biggest thing that I would add here, because I know that this is a thought that's probably going through most of your minds, and it did cross ours as well, which is, hey, we're tracking this in Epic or, Cerner, insert your EHR, or, hey, we've got supply chain, we've already got these types of solutions. And what I just want to make sure and I guess just really put an emphasis on was that we actually did go down that path at the beginning of this and really looked into saying, okay, if we're going to do this, let's do it right. Let's go to the systems of record and kind of understand. Very quickly, we found out that in order to meet the needs of the customer at that, agile pace, that wartime pace, where literally, what he called it was digitizing charts or digitizing paper, right? Where we're basically taking this very ad hoc manual solution that they were tracking literally in Excel and on sticky notes, and create that process and really manage that workflow. So as we tried to integrate with these other backend systems, this particular customer was using Epic on the back end for their patient tracking. They're also using Lawson for supply chain. And as we tried to integrate in with those systems, we actually ran into challenges around that agility. Whereas if I am a hospital administrator and I've got a PICU that I need to repurpose as an adult ICU, and I want to see that reacted in real time so that then I can start planning my resources and staffing to be able to staff that as an adult ICU to be able to treat COVID patients. The system of record just wasn't very good at that. It wasn't able to react in the real time, whereas they needed to see it. And again, on the supply chain component of this, again, we really wanted to take that system of record so that we had that single version of the truth. But again, what we quickly found out was that the supply chain was actually not matching what they needed to track on the floor. So they were actually doing hand counting of many of the PPE types of gear in order to get that real time count so that they knew exactly what was happening at those moments in time without having to wait for those systems of record to be updated. So I just want to be very upfront about that, because I think that is probably the most common question that we get asked is, will other systems do this? Yes, other systems do this. They do it well in peacetime efforts. But as our customer kept saying, this is wartime. We need to be able to react agilely. So that's just the one thing I wanted to add here, because I think it's probably the most common thing that we get asked. So Chauncey, back to you.
Yeah, and just to reiterate, like we're not trying to replace those. Systems of record exist for a very valid reason, and they're very powerful and they're wonderful tools. It's just sometimes it takes people in order to change some of that things. And of course, people have processes that they have to go through and a whole bunch of things. So whatever we can do to kind of address these needs as quickly as possible, that's what we're trying to achieve for our customers, or on behalf of our customers for that matter. So as Holly had mentioned, a lot of this stuff prior to us kind of stepping in was being tracked in sticky notes, in Excel workbook, and as amazing actually as that Excel workbook was, it was hitting its limits, which is pretty fascinating if you kind of really think about the amount of work that team had done around Excel to start tracking this data and start aggregating it as much as possible. They pushed Excel to its limits as basically a system of record, which it's not really kind of meant to be, right? And so what we wanted to do is we wanted to give the frontline workers the easiest way possible to quickly input data around detailed staff capacity, bed capacity, ICU capacity, stuff like tracking COVID status, discharge planning. But again, the point is not to replace any actual system of record capability. So a lot of folks will say, well, you're already doing discharge planning. Well, we know that our EMR has the actual planning itself. And in fact, we're regulated to make sure that planning stays in the EMR. We don't want to change that. In fact, we absolutely want to stay out of it. Instead, what we want to do is supplement that data with cross-referenceable numbers that can help kind of add a story or add more information around what is being tracked today. So the last bit is the other kind of consistent theme that we heard mainly out of this customer, but as we start getting this out to other customers, that we really have kind of three chunks to the story, which is the frontline staff inputting the data, actually like being on the floor, tracking things as is, and again, referencing back to these systems of record when they can, but in reality, they're just taking data as it comes in. You've got that kind of middle record, which is the facility and supply managers, the folks that are helping kind of the back end, uploading maybe facility level records of, say, how many vents are available, or kind of items around that. And then, of course, kind of that high level command center, whether this is at a system level or this is across the region, or heck, countrywide, once we get to that point, we're really trying to give all different levels some way to really gain value out of this product, whether that's data input or data visualization. So finally getting around to kind of what we did. We saw that this idea of data powers decision is kind of one of our mantras that we wanted to drive when we start going into building these applications. So as I mentioned, we're addressing the frontline staff, the decision makers, and all the admins throughout the entire solution. And what the solution is comprised of is an admin and configuration center. So I'll be kind of walking you through that, as well as the frontline staff mobile apps and this beautiful dashboard that Holly will be kind of talking about here in a bit. But before I move over to that, I do want to mention that we do actually have this great blog that was written by Sonia Singh, who happens to be, her engineering team has been pivotal in helping us develop these solutions and getting it to our customer. And so I do want to kind of give a shout out to the Power Platform team, both Power BI, Power Apps. These guys have been just crazy involved with all of this stuff, and they've been so passionate and so helpful. So I think it's really important that we kind of give them a shout out. But this blog is available out there. It does a great video walkthrough with this guy that has an amazing voice. That's probably even, it's definitely better than listening to mine for nonstop. So highly recommend going in there and taking a look. Does a great breakdown of all of the different solutions that are in there. And it has a direct link to the actual technical documentation. So from this link, you can actually go into the back end. So we did build out kind of the how-tos, how to deploy it, how to configure it, where to download it, and even from an end user perspective, how to use some of this stuff. This will continually be updated because one of the things that we wanted to do as part of this solution when we made it a template was make it to where we could take feedback from other hospital systems. And in fact, we're actively looking for that group. So if you feel like you are going to use this broadly, let us know, because we'd love to maybe throw you on our customer advisory board as we start iterating on this solution. So, that's a lot to be said as a setup. The next piece. Let's go ahead and kind of hop over to the solution itself. So one thing that you'll notice is out of the box, what this will do is it'll take you to, like I said, this link here. Everything is hosted up on GitHub for you to be able to download. We will regularly upload that. You think of this almost as like an open solution, very similar to the rest of our templates that we offer for Power Platform. And by the way, if you don't know what Power Platform is, go out there. There's tons of different information. I've got some blogs out there on my LinkedIn, but really the Power Platform community is probably going to be one of the best resources to learn what is this thing called Power Platform. And it's the future for us in terms of a no-code, low-code approach to application development, data visualization, automation. So those of you that are familiar with Flow, that's been rebranded as Power Automate, but we even have like virtual chatbot capabilities now within Power Platform. So it's growing and developing, and it was obviously a natural fit for us to kind of build all these solutions onto it. So let's go to the actual. Go ahead.
Really quickly, just before we move forward to the actual solution, I'm really excited to see it live. Just wanted to give a couple of shout outs. So we have Rob coming in from Geisinger in Pennsylvania, and then we also have another person, anonymous, from Brock, Pennsylvania. So we have a lot of Pennsylvania representation here. So we also wanted to just remind everyone, we have some really key experts on the call between Chauncey and Holly. And if you do have any questions, just put them in the live Q&A and we will get them queued up. And also all of the links that Chauncey's talking about, we're going to post those in the blog afterwards. And so there will be a link to the recording as well as the links to all of the GitHub that Chauncey is referencing. Any resources that you might need, we'll spell those out for you afterwards. So there are a couple questions on that. Just wanted to address that. And with that, Chauncey, keep it going.
Awesome. So before I actually move over, I did realize I should probably talk a little bit about what Power Apps is and what Common Data Services is, as they are some of the key components of the app side. So Power Apps, again, Power Apps is going to be our low-code, no-code approach to building applications or rapid application development. Whew, it's a mouthful sometimes. So you can think of Power Apps as the lowest kind of barrier to entry to getting apps up and running for your business. The beauty of Power Apps, and I'm first to say this, is how easy it is to pick it up. If you can see the piano in the background, I don't know if my videos are running, but I'm a musician by nature. I was a clothing sales guy for a few years, and then about 5 years ago, I hopped over to the Windows side. All that's to say that I've learned the Power Platform, or at least app development, in the last 9 months. And I'm still learning. There's still a whole lot, but I at least can get a lot of this stuff up and running very quickly. And so that, to me, is one of the best stories around Power Apps, and why we actually went this direction to use Power Apps on the front end. On the back end, we're backing all this onto what we call the Common Data Service. Let me get back here real quick. So the Common Data Service, think of this as a low-code, no-code approach to a transactional database. I know CDS guys, don't yell at me for saying that. There's way more. There's security roles, there's business relationships, there's a common data model that you can insert healthcare accelerators into. There's so much to the Common Data Service, but I think just for the purpose of what we're talking about here, it's a low-code, no-code approach to being able to quickly spin up a back-end data management system. So that's the Common Data Service. So on to the actual solution. Out of the box, what you're going to get in this template is a whole bunch of different things. So let me actually open that file just so you can kind of see it. So when you download it, it's going to look something similar to this. It'll be a zip file that you can open up. It's filled with app icons, some data files, both sample and kind of quick start data, I would say. It's going to have that new Power BI template that we're going to show off. It's got a couple PowerShells, so you can kind of disable some of the scripts just to make it easier from an end user perspective. And then, of course, it's got the solution files itself. So whole bunch of stuff, gets you up and running. It's even got a nice little checklist. So if you don't want to have to reference this how to, it's in an Excel format here in the download. But what you're going to get is when you install this solution into Power Apps, it's going to come out similar to like this. So it's going to be full of dashboards that are built into our backend model app. It's going to be filled with processes, security roles, and of course, our selection of apps. So let me kind of go and just show you real quick. If you were to go to the Power App Maker, this is going to be these first 1, 2, 3, 4, 5, 6. Did I count that right? 7 apps, sorry, which includes a launcher and the subsequent supply management apps, as well as the backend admin app. So let's go ahead and take a look at the app interface itself. So as an end user, and keep in mind that this is going to be something that your frontline workers see. As an end user, they're going to log into this app, and the first thing that they're going to choose is the hospital system that they work out of. Of course, in my case, we have Smarter Health within Microsoft, which is kind of our fake entity that we get to run off of. But we have just the one hospital system, but I do have multiple regions, so I can quickly see that I have like Atlantic or Pacific Northwest or Southwest, kind of whatever I want. I'm going to go ahead and choose Atlantic. And I'm going to go ahead and choose the facility that I normally work out of, so maybe Capitol Beach. Let's go with St. Shenandoah. So let's hit next. And so at that point, now we're kind of quote unquote locked into a facility. Of course, any moment if they are kind of moving to a different location or whatever, they can go back and change this if they need to. But we are presented with the top kind of 5 apps that as an end user, I need to be able to use. Now, one of the beauties of this solution is, as you can see, these are all separate apps, which means a bunch of different things. One, you can actually hide them per individual that syncs. So maybe I only need to be able to input supplies and staffing equipment, or maybe I only need to track COVID-19. I can hide these per individual just to make it a little easier from a management perspective and actually from an end user perspective. Too much noise, especially from a clinical frontline perspective, we don't want them to be overwhelmed, and so the quicker they can get in and out of the app, the better. But let's kind of go through as if I do have access to everything. And so the first one up is the staff and equipment app. This app is really kind of built around quickly tracking, again, stuff that might be in the system of record, but more importantly, we just want to be able to kind of quickly have a cross-referenceable record. So here I can go in, track what location I'm in, and right now location for us is a concatenation of floor plus unit. You can override that if you want, so if you want to kind of change what the location means to you guys, that is one of the things that you can customize. But in this case, I'm just going to track how many patients I have on this floor, so I'm going to say 18. Partners, think of this as kind of like your extenders for registered nurses on duty. So I'm just going to have 5. And then I need to get, 3, and I have about 6 assigned on this floor, and I don't have any assigned. Everyone's kind of getting put to use. In terms of equipment in use, I'm gonna put 5, and then since I have put 6 paper units in there. You can fix some of this stuff. So this data backend is something that's a little bit customizable. We do release these templates as a managed template, meaning that, again, some things are customizable. However, for the most part, we kind of keep it semi-locked down so we can treat it almost as like an app, and we can just kind of update the app as needed without kind of crashing your guys' backends. So now that I've kind of filled this piece out, I can either I can hit send, which will take me back to the home screen. And then in future iterations, we'll also be presented with the ability to re-enter, so we don't have to go back into staff and equipment. It'll just kind of wipe that form and let us go on. So that's staff and equipment. Again, that's tracked at the location record for the most part, and all this stuff can kind of be tracked. And you'll see what that means once I kind of go into the backend app. Any questions? No. All right. So next up is going to be our supplies area. This is one that I've actually seen a lot of customers asking about. Again, there's great systems of record out there that can help you track some of this stuff, but more than anything, we just wanted to give someone a very quick way to show what's in stock and what's been used in the past 24 hours. This is tracked at a facility level, but you can go in. It is mandatory on all these fields as of right now. So we can say what's available and what needs to be moved and everything like that. You can add additional items too. So if you go into the backend that we'll show in a bit, you can add other supplies if you want, and this just becomes a scrollable list if you need to add more. The one thing I will say from a user perspective, the longer the list is, obviously, especially if it's a required field, the more that they're going to have to scroll. So just kind of keep that in mind. However, if there are certain metrics that you need to track today, make sure that they get in here. So I'm going to go ahead and hit send. And that's our supplies track. And a lot of this stuff will make a lot more sense as to why we're tracking this once we show you the backend data. I'm going to skip the staffing needs for a bit because I think there's a broader story around that. So I'll come back to it. But up next, we have the COVID-19 stats. Sorry. This app, again, isn't about replacing what's already being reported. It's more about giving a cross-referenceable record that can be quickly entered and kind of up and on the move, right? So we can change the location that we're in. I can add numerous locations if I need to. So I can add every location that's in the hospital if I want to. It kind of depends on how the end user is going to be interacting with this. And again, these are things that you can lock down in terms of only certain people being able to not only enter data, but see the app itself, but also access the data. So you have full security controls around this through the power of Common Data Service, as well as our Azure Active Directory groups. So I'm going to say there's 5, why not 8, 4, and 3 of people under investigations or patients under investigation. And then of those, realistically, it's probably about 4 that are positive, let's say 6, 2, and 1. And then I can hit submit. I can even delete these line items as I go as well. Next up, we have discharge planning. And in here, again, this is around tracking barriers to discharge. So it's not going to actually track the discharging. So we don't want to take over that system of record. We know that there's a lot of regulation around that, and so we're staying out. But instead, we're just giving some of our decision makers a high level of what's blocking individuals from being discharged. So we have 5 that are under authorization, 3 that are being blocked for durable medical equipment, and I'll just kind of fill out the rest of these. Ooh, that's a lot. And then a high-level tracking of kind of discharges in the past 24 hours and what's likely in the next 24. Before I get out of this, a couple things I did want to mention is we do have a feedback button as well. So in the app itself, this feedback goes to you guys. So as a customer, it'll aggregate any kind of feedback that your end users are getting into. So if they click on here, they have an option to choose if it's an issue, idea, or praise, input their comments, and then hit send. And that they can take it back to, and it keeps them where they're at from within the app perspective.
Hey, Chauncey, we do have a couple of questions for you if you want to pause here for a second. Great. So
Beautiful.
Rob's asking, are there hooks in the template to auto-populate information if you could extract it from your EHR so people don't have to do double data entry and it's up to date?
It's a great question, and Holly, you and I are going to tag team on this answer because I think you kicked it off in a good way earlier. You could absolutely pull this data in if you needed to. Common Data Service itself has an ability to actually pull in the data as part of the backend. So if I go here to data and then entities, I can get data from numerous resources in here if I wanted to. So pull it in from an Excel, or I can make a live connection to some of these resources that'll be popping up here shortly. So that's one way to ingest data into the Common Data Service. And then from there, your app is effectively just looking at that source. And so you can just do that. You could also technically create your own live feed to that. So instead of using a connection into the Common Data Service, you could just create like a custom connector. In our experience, most of our kind of say EMRs or tracking systems don't really have like Power Apps or Power Platform connector, so you would have to create something custom. But as long as that API is available, whether that's in the form of Fire or something maybe that's already been created, it's pretty easy actually to create a custom connector to get the data into either the app or again back into the Common Data Service. So that's all to say you can do it. Holly, you want to talk about why you might hesitate doing that?
Yeah. So as Chauncey had said, we can absolutely, utilize those quote unquote systems of record to, like I said, auto-populate like things like locations or acuity or, kind of those more reference types of tables. As I said, we looked into this at our initial customer. And we actually ran into a bunch of challenges. And this, may or may not be a common scenario across many customers, but the way that the actual hospital facilities referred to their locations were a different way than the actual departments were managed in Epic. And so, meaning to say that there was not a one-to-one relationship between the locations in the app versus the system of record in the EHR. So by allowing them to have kind of that free-form structure where it did not have to exactly match the EHR, they're getting what they need from the way that they refer to these locations, which was basically a floor and a unit. But in reality, in the EHR, it was actually at a department level that could span multiple floors. So it ended up creating this weird many-to-many relationship. So it was actually, the decision was made for them to do this kind of out of band. We do get questions of saying, hey, can we load this from our EHR? And absolutely you can. And like Chauncey had mentioned, we do have APIs for that. I guess the question being is just making sure that what is in the EHR is how the hospital is actually managing their scenarios. That would be the first thing. The other thing around, why we're not using that exact hierarchy within the EHR is that in many cases, depending on the level of emergency or the severity of the situation on the floor, we had to be able to have the capability of adding alternate sites of care on demand. So, I'm spinning up a hotel or I'm setting up a tent outside. And I need to be able to have that online to track patients and supplies and staffing in real time. So with the app, we were able to handle that. And that's really kind of the whole point of this, is really being able to respond agilely to that type of situation. Whereas, going back and really hosting everything from the EHR, it didn't really work. So that remains to say, you can do it either way, but there were absolutely very specific reasons of why we did not go that way. So hopefully that answers that question.
Awesome. Thank you. That makes sense. And Rob, let us know if you have any follow-up on that one, but we do have one more about licensing. So this person, it looks like, has a P1 E3 license. Does this require a P2 license or the pay per user app plan? Can you go into licensing a little bit?
Yeah, so great question. It sounds like you have a pretty decent idea of how Power Apps works in terms of requiring certain licenses for Common Data Service, because as this entire solution is built off of the Common Data Service, it does require, at the very least, access to those licenses. You may or may not be aware that we did change. So back in October, we made a move from P1, P2 to per user, per app. And so as long as you have either a per app or per user, you're good to go from the new perspective. From the older perspective, P1 access, so being able to access Common Data Service information, should be sufficient. I'm trying to think if there wouldn't be. However, one thing I will say is that your account team can apply on your behalf to get a special 6-month trial up to a certain amount of users, where Microsoft will actually give you guys, like I said, a 6-month trial against the entire license backend to be able to support this. That is a new Power Apps per user trial. So not only will you get access to this, you'll actually get access to be able to see what the new license is like. If you are familiar with P1, P2, the per user is pretty close to P2. We kind of did away with the old model structure where they were kind of different. Now it's more about licensing it per app or per user, but the functionality is the same. So long story short, P1s should work. Can't think of why it wouldn't. P2 obviously would for sure, and then if you use any of the per app or per user, you can do that today. Just a thing to note with per app, there is, like I said, 6 apps. Ooh, actually, thanks for bringing that up. So P1 doesn't have access to model-driven app, and so one of the next things that I'm going to show you is the backend model-driven. So your admins, or even kind of your floor admins, are going to need to have at least a P2 license to be able to access the model-driven app. And then from a Power BI perspective, Holly, I'm gonna let you chime in. I typically trip over.
Yeah. So for the Power BI perspective, because this is built on top of Common Data Store, Common Data Service, we would require. It depends on the level of latency you would need your data. So, basically the way that Power BI works is we've got what are called Power BI Pro licenses, and that's really what you would need to be able to, open up the Power BI template and publish that up to the service. So, you'd probably require like a handful of pro licenses, but the bigger component of this is whether or not you would need what's called a Power BI Premium node. And a Power BI Premium node is going to get you the ability of being able to publish and have the dashboard used by upstream users that do not have a Power BI Pro license. So, you're able to have that deep consumption across multiple different users. The other reason why you would want to go premium, though, as well, is that the level of latency is 30 minutes on the data refresh versus every 3 hours for Pro. So as to Chauncey's point, one of the things that we are doing as part of this solution as well is that your account team on your behalf can submit a request to get a temporary Power BI Premium node assigned to your tenant, so that when you publish this solution as part of that workspace, you can host it in that premium capacity, which gives you the lower level of latency, and it also gives you all of those upstream consumers without requiring everybody have a pro license. So, so that's in there as well.
Awesome. Thank you all. And the last question that we have before we move on is about APIs. So Edward's asking, do we have APIs for Cerner? I'm sure we have people on the call that are curious about, Epic, Allscripts, et cetera. Can we go into a little bit of resources around those?
Yeah, so as of today, no. So when it comes to any of our connectors, so let me kind of get rid of this search term. It's up to our vendors, so the other vendors, to be able to create those. So unless it's like us creating, say, the Office Outlook one. But in terms of Epic or Cerner, they haven't created an actual API to connect into Power Apps itself. However, like I said earlier, what you could do is create a custom connector. So you could go in here into custom connectors, create a new one, and you can do it based on any of these options. So you can create from blank, you can create it on an Azure service, an Open API file, Open API from URL, or import from a Postman collection. And any of those kind of gives you that option to really tie into Cerner or Epic. I know, I don't, Holly, if you want to chime in on that, I know there's kind of more around it. Fire might be the easiest way to do some of this stuff. I've seen, Epic and Cerner kind of do their own things in terms of an API, and actually connecting to those is something that, my team and kind of the broader Smarter Health team has been trying to figure out. But we've been kind of focusing on Fire just because of its kind of open source nature, and it's a little easier for us to access stuff like that. Go ahead, Holly.
Yeah, so typically the way that we would interface with systems like Epic, Cerner, Allscripts, is, as we all know, especially like, with Epic, with the cache database, it's not super easy to be able to connect into. So typically what we would do in that case is a couple of different things, which would be, just tying into either Clarity or Caboodle to be able to get that data in more of a relational format. And then you could do, some sort of ETL type of process that would load that data in. The other thing is that we did have the customer look to do like Epic Report Workbench types of reports that would kind of export that data out as well. So there's multiple ways around it without having to go directly to those systems. As Chauncey had mentioned, we do have a Fire API where if we go to, OpenEMR, we can do that as well. But for the most part, I would say because it's not really, in real time, writing data or pulling data directly from that Epic system, depending on how up to date your Clarity is, we can definitely pull from that. Typically, that's a nightly load, so in many cases that will not work. But for instance, if you had Report Workbench types of things that were extracting that data, that's another way that we could do it as well. So it just goes to say, how much work do you want to tie into those backend systems, and is it worth it? Because again, with the whole agility, it adds time, it adds testing, it adds more moving parts that quite honestly just provide overhead. So I guess that would be my biggest, clarification point of things to think about, which is, is that something that is absolutely 100% needed? Because again, we do realize that that's the system of record, but from an operational emergency management perspective, sometimes it creates overhead that slows this whole process down. So that being said, there's multiple ways we can do it. I'm happy to follow up with you offline if you do have a question around that. But you know, I guess that's what I would throw out there in terms of an answer.
Great. Yep. Thank you all. And we can keep moving forward. No more questions for now.
Awesome. Yeah, and if I can implore anything on this call for the individuals that are listening, keep in mind that the core reason we did this is agility. We want to move as fast as possible, and we want to be able to report on this stuff as fast as possible, cleanly and correctly as possible as well. And we don't want to create any kind of issues down the road. So I get it, right? Like that's why you're looking at kind of making those connections and kind of keeping that back end connected as much as possible. But if you feel like you can address that in your system of record fast and with agility, go that direction, right? I mean, like this isn't a template. We're not here to make any money off of this actual product during this time, right? I mean, that's not the reason that we came out with this solution. The solution was to address a very short-term need that can maybe be spun up at another emergency. God forbid we ever have another one. So that being said, let's kind of move over. So I think we moved through everything here. Want to make sure that Holly has plenty of time to talk. So I'm going to quickly just show you the staffing needs. I'm not going to really walk through this, and I'm going to tell you a big reason. We are hearing loud and clear that this is something that's coming up. If you see this and you say, hey, this looks like something that my individuals might be able to use, please reach out to me either on LinkedIn or through follow-up, however you need. I'm actually building out the entire backend, or I should say my peers are building out this entire backend for this for our customer today, because right now this app is really pretty much just one direction. You send it, the request goes into CDS, and as an admin, I can see it in this admin app, which I'll show in a bit. But for the most part, it's not really giving anything in terms of like a triaging capability. So we're building that triaging capability. Right now, we're building it pretty focused on our one customer out west. But if this is something that you need, let us know, and we may or may not push it into a template. In fact, I know we're going to push it into a template at some point. It's just I'm not sure when. So we're working on that. So that's the staffing needs. We do kind of go into it in our documentation. But I would recommend that if you don't have the backend on this, unless for some reason you kind of want to track it in the admin app, I would probably just hide it for now. All right. Last but not least, the admin app. So instead of having to interface directly with Common Data Service, one of the things that we wanted to make sure out of the box that you had the option to do, especially because your business users might be actually doing this instead of like IT taking it over, is giving you something very quickly to be able to upload the information you need. So you can go in here, add the systems that you want, your regions, your facilities, the locations. And again, today, location name is auto-populated by a concatenation of floor and unit. However, you can override this field if you need to. You can add departments, and you can add the acuities. And actually, I would argue you need to have all of this populated with some kind of data to really kind of give you the rich data set needed for the reporting. So if the solution itself takes like, I don't know, 20, 30 minutes to install, it doesn't take very much at all. In fact, I do it kind of on a regular basis. And even though I'm decent with Power Apps, I'm by no means like the expert. However, it really just doesn't take much to get this up and running. The longest part is going to be getting this data in here. So make sure your data is right, make sure it's clean, and make sure it's kind of aligned as close to as possible with what you want it to be. In this backend, again, you can kind of see the different things. You can track per location some of the input that's going in. So again, we did like blocked beds and last census earlier, if you didn't see that. You can track, you can see what's being tracked at the facility level. So like total events and the actual discharge numbers that we were putting in. Supply management. So you can go in here, and this is where I was saying if you had a different supply you wanted to track, you can easily add that supply with just a supply name and description. It'll show up. And then any of those trackings are in here as well. So again, this just kind of gives you that back end view of the front end that's coming in. So this is all the data that's just kind of residing in Common Data Service right now, and just kind of gives you a nice app interface to work with it. Back here in the bottom left corner, you'll see the staffing area. So those labor pool requests I was just talking about, or any kind of the staffing needs. The admin side, so this is where you're going to actually manage your apps. So this is where you can go in and say, hey, I need this to be the first one that shows up on the list. I'm going to actually call it something else. So maybe I don't want it to say employee launch app. Maybe I want it to say COVID response app or something like that. You can quickly change that in here. And you can also, like I said, hide it from the menu if you want to. And then your app config files live here, any of your app feedback that's coming in, and then of course like those random census, COVID, and equipment needed tracking. So that's kind of the data side, you could also see a quick, Holly mentioned as like a histogram, right? So don't think of this as like the replacement for Power BI. That's not its intention. Really, this is just going to give you some nice, quick, easy visuals out of the box of some of this like bed management and staff management and COVID patient stuff. That's literally all that's there for, is just that kind of quick visualization. Instead, the rich data side, the rich impactful data piece comes into play with the Power BI dashboard, and that's where I'm going to turn it over to Holly. Holly? Unless there's any questions on this app. Nope. All right, Holly, you're up. And you're on mute.
Yep, no question.
Perfect. Trying to find the mute button. I'm so sorry. Okay, so let me come over here and share my screen. Let me know when you're seeing it.
Yep, good to go.
Okay, perfect. Okay, so this is the Power BI dashboard that we had created specifically for the customer, and that was built into the template version of the app. So you can see a lot of this has been anonymized. So we've got, Contoso Health, but you can see here that we've got a lot of information here on the screen itself. So, as we were kind of putting that data into the application, we have the ability, to get that full system at a glance. Here, depending on how you have the app set up, we have the ability of tracking multiple systems within each system. So, if I wanted to look at just Alpine, I could go ahead and select that, and it's going to actually cross filter all of the different components on the screen. Might help if I actually select it. And then what it's going to do is it's going to then filter down all of the information. So here, if I wanted to go to a particular region within Alpine, or if I wanted to just select an individual facility. So this kind of gives you that overall admin glance of, how am I looking for my resources across multiple different facilities that are aggregated up at different levels. And so I've got all of that control here. So here, we've got the different components of the data that we were tracking. So we've got the number of COVID patients. So, as Chauncey had mentioned, they've got the COVID patient under investigation and COVID positive. They wanted to track those as two separate numbers. From a reporting perspective, they need to assume that everyone who is presumptive positive for COVID is tracked under that COVID patient. As well, we need to look and see how all of those resources are being spread to be able to handle the patient load that may or may not be coming in, kind of looking at these trends. So here what we've got is the amount of available beds. And so, we look at it by all bed type, but then we also have the ability of doing things like by acute care beds. So when we think about location acuity, these are things like ICU or med surge that are available to be able to handle those higher severity cases where, we might have ventilators present, or we might have, 1-to-1 nurse to bed ratio where we're able to handle those acute patients. Down here, so this is doing it actually at that facility or at that region level, depending on which view you're looking at. And then what I can do is I can actually go in here and I can see my non-acute versus my acute. I can see the different units here that would be specified underneath that, and then it gives you all of that information here. From a staff management perspective, we had originally started down this path of looking at variances, but actually variances didn't really make that much of a decision-making difference. And so what we really wanted to do here was to track nurse to patient ratio. And you can see here that ICU is actually brought out to the top here because those are the ones that, have that specified acute care, and that we would require that higher ratio of nurse to patient. We're able to treat those more like a 1-to-1. So again, the same sort of thing here, where you can see the census for all of my different units, how many nurses I have assigned. If I have RN partners, so these are things like floating nurses or extender nurses, and then what is that nurse to patient ratio as well. The discharges, this became a really big piece of the scenario that we were working on, which, as Chauncey had mentioned, the discharge planning, all of that happens within Epic, but they actually had a separate component of discharges where what they wanted to track was the discharge barrier to be able to take out those long length of stay patients that, were quote unquote stable enough to be able to be discharged to either a long-term facility, to guardianship, whatever that might be. So we want to be able to track that here as well, to be able to just see, okay, if we have this level of discharges, how many beds or how many beds can we free up from that perspective. The equipment, the decision was made that we wanted to just show the ventilators on that current screen. So we're looking at, how many total vents do I have in inventory? And again, the reason why this becomes super important to look at it at a system level is that for many cases, we knew how many vents we had in the facility, we knew how many vents we had at the location, but actually getting that view at the system level was super important. And then the same thing for the supplies. So, just kind of looking at the different elements within that and being able to just get that quick view. So the way that the customer uses this that we worked with was they actually use this dashboard to drive their huddles. So that they can interact with that, they can be asking questions and looking at that data interactively. The next part of this is going into what we call the location details. So the location details is really that place where, think of it where your charge nurses or your unit admins, where they're actually looking at how are they doing at this particular point in time. Now this is super important because what we're doing is we're actually taking the latest records that were input as part of that application, and you can see here that we're actually time stamping that so you can see how old the data is. But we're tracking all of these sorts of things. So number of total beds. We've got the different census, the available beds. How many surge beds am I able to have within this particular unit? So, beyond my licensed bed count, how many beds can I surge into to be able to handle these types of patients? How many COVID positive and COVID PUI patients do I have within here? And then as well, all of my staffing information. And again, this is all filterable by those different components. Now, if you go to the system at a glance view, the other thing that we can do here is that with each one of these, this one's might not be linked, but we can go into all of the different details behind each one of these. So here's my COVID patient information. So I can see, again, how many COVID patients do I have within this particular facility or this particular system. And then I can see by location here. So this is just giving me kind of that same facility information. But now what I can see is that trend over time. So I can see how my numbers are looking from either day to day, hour to hour, whatever that looks like, and how those trend lines are actually affecting different things. I can also see by different units. So if I want to go ahead and select like ICU, what this is going to do is it's just going to filter down that ICU data. So again, from a system level perspective, we can see all the different ICU facilities in one single view, whereas before they had to kind of flip between a bunch of different Excel spreadsheets. If we go here to the bed management, again, this is looking at the number of available beds. Again, I see all the different detail here, but because this is in Power BI, the cool thing about this is that now when I go ahead and select, different facilities, I can see all of the, it looks like they don't have any acute care beds. This must not be an acute care unit. But here, let me go ahead and gen surge. So again, it kind of cross filters all of that data to be able to see that in real time. Staff details, this again is giving me a little bit more staffing information, but what we've done here, and this was something that they did not have this visibility into, is looking at, how many nurses do I have assigned? What is my nurse to patient ratio? But then what we've also done is overlaid things like census, as well as the total COVID patients. So you can see here the different correlations between how much staff variance do I have, versus what does my COVID number look like? So I can start looking at kind of creating that correlation between the different components. Also, if I wanted to see, what did this look like on April 1st versus April 2nd versus April 3rd, we can do that as well. So we can see all the different dates and kind of point in time. This is actually the equipment details. So again, we're looking at COVID patients and looking at the number of vents. We're also tracking PAPRs as well. So PAPRs are the protective suits that have hoods and belts to be able to treat those, very infectious patients. So we're tracking those as well. We just don't show those on the front page because those weren't as critical, but we have all of that information as well. And then finally, the discharge component. So again, you can kind of see all of the different counts here at the facility level or within that facility. And then, you can look at the different discharges and you can see again how that is kind of trending over time. The last thing that we added in here was if I come here to the system at a glance, and actually this is for all of the different pages, but I think it makes the most sense here, was that we have the ability of also just looking at what are my COVID units. So instead of looking at everything all at once, if I were to just filter down all of the locations that were specified as COVID, I can actually look at how that affects my resource balancing and what it looks like. So when I look at my different COVID units, you can see here that acute care occupancy went way high because it's only taking into consideration those particular units. So I'm going to pause there, and if there's any questions, I'm happy to take those. I realize we've got 6 minutes left, so I will pass it back.
Yeah, yeah, thank you so much, Holly. I think the one question that was asked was sharing a link to Chauncey and Holly's LinkedIns, which after every webcast that we have on the aka.ms/HLS blog, we will share the recording, we'll share all the resource links, and then we will also share all of our LinkedIns directly in case you want to connect with one of us directly. So that will be on the blog tonight. So just check that out. But with that, that was the last question. So if you want to show anything else or go over anything, reiterate anything, feel free, Chauncey and Holly.
Yeah, I just wanted to mention that we do have, touch my face, ooh, bad. We have tons of peers, by the way, throughout healthcare, but also throughout the rest of Microsoft, covering all of our healthcare accounts for the most part. If I'm not the person, just know that if you do reach out to me, I might be looping some other folks in just to make sure that if someone has kind of like been your main point of contact, we want to continue to make sure that that relationship's there. But yeah, I mean, we're really excited to have this out in public. We're really finally excited to see what our customers can do with this. Again, there's some customization, but if there is major pieces missing, please let us know. You know, we're like I said, we're putting together like a customer advisory board of sorts to kind of help advise as to how we want to kind of tailor this template and what it's going to look like moving forward. But we are going to continue to kind of update this and maintain it throughout the crisis and make sure that you know, this can serve as many needs as possible. Holly, you got anything else to mention?
I do. So obviously, you know, we created this app you know, based off of the information we had at the time. But one of the things that we did that we were made aware of is all of these CDC requirements that are coming to bear, being able to, you know, give more detailed information at that federal level. So, you know, as Chauncey had mentioned, we're working on creating the regional app, which would be at the state level, to give, you know, more visibility and transparency even across systems within a particular geographical location. But the other thing as well is when the mail came out from Mike Pence around these whole CDC data requirements, when we did a data diff, we're actually tracking about 70 to 80% of this information in the app today. So, you know, as you're looking at pulling this data together from that CDC perspective, by using this app, it gets you a lot farther on the way there. And so, you know, what we're working on right now is, are there automated ways that we can push that data up to the CDC, you know, whether it's generating CSV files and pushing that up, or, you know, whatever that looks like. So, you know, with this information coming to bear, like I said, most of this stuff we're capturing today. So, you know, just keep in mind as you're having to do this reporting, this is one of the things that this application can help through as well. That's all I had.
Okay, and
Cool.
we do have a couple more that are piling in here, people getting in their last minute questions. So first of all, do the apps support offline functionality?
So out of the box, no. Power Apps, yes. So Power Apps itself can actually support offline capability, but we didn't build those just in the case that we wanted to make sure that the connectivity was there. You can build that into it, and it's not terribly hard, honestly, to do, especially because we're doing mostly just data input. We're not caching anything in terms of pulling data. So going back to Holly's kind of overhead stuff, if you are going to be pulling data into the app, that's going to add a lot of overhead trying to make these offline. But because we're just doing data input right now, adding offline capabilities, there's some quick articles about how to do that for Power Apps. You can do that today. So yes.
Yeah. And then sorry. And then the other thing on the dashboard is that we can have this on mobile devices, so that if you need to take devices outside the facility, or you need to have this on your phone or whatever that is, wherever you're looking at those reports, we can absolutely cover that as well.
Yeah. And then, sorry, is that it?
Yep.
Okay. And then, so the last question that was out there was the whether or not we need to get a partner engaged to get this up and running. Out of the box, no. You could totally do this on your own. Like I said, it takes about 20 minutes to get the solution in there, maybe a couple hours to get the data up and running. But that's very dependent on a few things. One, a little bit of Power Apps knowledge. So if you don't have some of that, go ramp up on it quickly. Two, having an idea of what your data is, and really you want to have ownership around this entire product, regardless of whether or not you get a partner in there. You need to have someone that's going to be willing to kind of take on some of the feedback, the follow-up, and all those kind of pieces that really just typically fall on app management. So on that note, is it beneficial to have a partner involved? Yeah, probably, especially when it comes to customizations and kind of responding to that customer feedback. It's going to be a lot easier, I think, for a partner to be able to do that while you can focus on the business needs instead. Do you need it? No. Is it useful? Absolutely. Anything else?
That is it for the questions.
That's it. That brings us to the top of the hour. Mike?
Yeah, so I want to thank everybody. Chauncey and Holly, thank you so much for joining us today and for getting this out there. I know a lot of customers will be benefiting from this, and we will be having this on the blog this afternoon. Samantha or Sam is going to be posting that up, so we look forward to that. But I just want to thank everybody for joining us today. Again, if you need to find any of our content, including the recording, you can always go to aka.ms/HLS blog. That's aka.ms/HLS blog. And with that, we want to thank you. Have a great day, everybody. Take care. And as always, ciao.
Thanks all.
Thank you.